Hi, I'm Jeff Marcus, and this is the Substance Abuse Overdose and Intervention Training for Emerge Nursing and Rehab Personnel. Now, the reason why we're having this training is back in 2016, the CMS released the State Operations Manual, 826 pages of rules and regulations. So many rules and regulations, new changes, over 500 of them. They give them 4 years to roll them out. And this is the final phase. And this is the training. We have to train the staff on recognizing drug abuse and alcohol withdrawals. So the goal is to educate the staff on the signs and symptoms of substance abuse and overdose so interventions can be put in a timely fashion. At the end of this training, the staff will be able to identify signs and symptoms of substance abuse. The staff will be knowledgeable in the signs and symptoms of alcohol and benzodiazepine withdrawal and know how to intervene if substance abuse is suspected. Look, our population has changed over the years. We're now admitting patients, baby boomers, who may have substance use disorders, which include alcohol, benzodiazepines, such as Ativan and Xanax, marijuana, opioids, things like heroin, Vicodin, Percocet, oxycodone, and nicotine. Do you know who are the largest users of marijuana today? The 55 and older and above. It's true. So what is the definition of substance use disorder? Well, it's a recurrent use of alcohol or drugs that causes clinically and functionally significant impairment with such as health problems, disability, failure to meet major responsibilities at work, home, and school. Now there's a theme here because the definition of dementia is a cognitive disorder that is so severe it interferes with everyday life. The definition of post-traumatic stress is as being a trauma survivor where the effects is so severe it interferes with everyday life. Just like substance abuse disorder, it's the using of drugs and alcohol in such a way that it interferes with everyday life. So, signs and symptoms of substance use disorder. The bloodshot eyes, number one. When I was in junior high, we all carried Visine in our pockets. Weight loss. That's a sign of substance use disorder. Interruptions in sleep patterns, difficulty getting to sleep or sleeping too much or not being able to sleep through the night. Changes in complexions like acne and paleness and jaundice, rather. There may also be scabs and scars, bruises, and track marks. Poor personal hygiene, a decline in bathing, brushing one's teeth, general appearance. Track marks, obviously, from injecting drugs is a sign. Changes in behavior. In addition to the physical changes a person may show, misusing alcohol and drugs, they may act abnormally. Some significant behavioral signs of drug use in adults include a secretive behavior, withdrawing from friends and family, looking for private places to use their drugs, ignoring responsibilities, avoiding daily responsibilities such as work, school, taking care of the home, financial distress, frequently borrowing money or not knowing where someone's money is going, psychological symptoms. When someone misuses drugs, they also experience changes in their feelings, which may affect behavior. Some common psychological signs include depression and anxiety, low self-esteem, poor motivation, and irritability and mood swings. Signs and symptoms of drug overdose, small constricted pinpoint pupils, that's for opioid overdose, significant lethargy, loss of consciousness, shallow breathing or weak breathing, no breath sounds, choking or gurgling sounds, limp body, cold clammy skin, lips and fingers turn blue. When you suspect these a drug overdose. It is a medical emergency. So in our facility, we call the code blue. We follow by the location. All the nursing staff will report with the equipment, and they will start to amble bag this victim, help him with his breathing, obviously, while someone gets the Narcan from the emergency box located in the supervisor's office. They'll draw up 0.4 mgs of the Narcan, administer it into a large muscle, deltoid, leg, or buttocks, wait 2 minutes. If no improvement, they're to inject again. Prepare the resident for transfer to the hospital. Signs and symptoms of withdrawal. Withdrawal from alcohol, diazepams can be unpredictable and intense. The withdrawal process can start as early as 6 hours or 1 to 2 days after the last use. Delirium and tremors, also known as DTs, are severe forms of alcohol and benzodiazepine withdrawals, and it can be fatal. So what do? If you suspect a resident withdrawing from alcohol or benzodiazepines, you contact the medical professional. That means the CNA to the nurse, or the nurse will notify the doctor to receive interventions. We have to look out for people who are on visitations or going out on pass. We monitor for changes in residents' behavior, particularly if they're out on pass with a visitor or returning from an out on pass, and that includes increased unexplained drowsiness, lack of coordination, slurred speech, mood changes, and loss of consciousness. If such an occurrence happens, you can ask the resident if they've been using drugs or if they have illegal substances on them. Steps to take: report immediately to your supervisor, increase monitoring and supervision of this individual, restrict supervision if suspected that they're supplying the resident with drugs and alcohol, voluntary drug testing, and voluntary search of the room if there's reasonable suspicion that they have contraband. In order to do a search of their room, though, they must give written consent. That's right, a signed consent must be obtained so the resident knows what you're looking for. And if the facility determines there's illegal substances that have been brought into the facility, you will contact the DNS or the administrator, and they will call the police if necessary. Any questions? Kindly complete the quiz. Return to the staff educator's office. If you like my video, give me a thumbs up, subscribe to my channel, and I'll see you next time.